Thanks so much, Deborah. And thanks, Angela and Emil, for your remarks before. Emil, you did something which was really locate who you are and what is behind your own investment in abolition. And so I wanted to do the same and share a little bit about myself, because you all have bios, but that doesn't tell you what brings people to this work and their approach to this work. So I'm a Muslim South Asian immigrant. I came to this country when I was 14, and like some of you can probably relate to, my very traditional immigrant family was keep your head down, you work hard, and things will be okay. When I was in college, and we're talking the late 1990s, so before Michelle Alexander and the new Jim Crow, and before even the term mass incarceration was a phrase that we all understood, what do we mean by that horror? The very first time I walked into a prison was when I was 18 years old. I did a college and prison program where students from my college went into a maximum security facility in upstate New York. And there are moments in your life where you see something and you can't look away. And that's what that experience was for me. And shortly after 9/11 happened, and that was another experience that for my family and for myself, it gave not only injustice a very clear frame, but also added a political analysis to how we understood our place in this country and our place in the political power structure. And it was the first time I understood, it was the first time my family understood that things that have been happening to Black and brown communities across this country for generations are now happening to mine. And I say that because I think everybody needs to locate personally, where do you come to this work? It cannot be an academic exercise, because people's freedom, their well-being, our abilities to thrive, it's not academic, it's very, very real. So I've been working in this field for a little over 20 years. I was a public defender for many years in the Bronx, and for the last 7 years, I've been at the Vera Institute of Justice. And some of you might know Vera. We are a 60-year-old organization. We're one of the largest criminal justice organizations in the country, and we're known for our research and our partnerships on the ground with government and community partners to come up with concrete solutions. We are not known as an abolitionist organization, and I don't consider the work that Vera does abolitionist, because we do work in jails and prisons, and some of our work, I think, to Emil's point, certainly contributes to adding more money to that correctional budget or working directly with police departments. That said, I think there is a really important role in the larger movement ecosystem of how we all come to this work, and the role that I see an organization like Vera is a harm reduction one. And I think the standard that we hold ourselves to as we do our work is this a reformist reform that we will later have to go back and undo? Or is this getting us further on the path to actually having the presence of life-affirming institutions? Because abolition isn't actually the absence, it's the presence of the things we need to be safe and to be free and to thrive. And so I wanted to talk specifically today about policing and first responses essentially to people in crisis and people who need help. And in this country, the police have been historically the first and only answer to what our communities need when something happens that is a crisis. There are in this country 240 million calls to 911 each year. 240 million. And people are calling for something, and the vast majority, well over 2/3 of those calls, are not for anything that involves even something that is labeled as a crime. Oftentimes it is for a mental health crisis, it is for a medical crisis, sometimes it's as simple as a noise issue, but it's not the kinds of things that we need police to respond to, or that police are well suited to respond to. And I think that acknowledgement at a base level, whether you are abolitionist or not, I think is the place to start. What is the right response to crisis when it happens in our communities? And right now we spend as a country $115 billion a year on policing and law enforcement. And this moment, I think, is a really important time in which to be having a conversation about alternatives to policing and taking police out of the role of being first responders, because we are finally seeing, after the murder of George Floyd and the uprisings in 2020, and again, that even after that, we have seen over 1,000 people die each year at the hands of the police. I think there's a true reckoning, even among folks who, like my parents, aren't abolitionists, or in communities I come from where people are more moderate to conservative. There's a real recognition that what we are doing doesn't work. And we've actually seen a remarkable amount of power and organizing and advocacy lead to what I think is a critical shift in how we are using our resources and our dollars. And so just a very concrete example is today we have seen over $79 million in this country invested in mental health first responders and community violence intervention. And mind you, 79 million compared to 115 billion is a drop in the bucket. It's the start. It cannot be where we rest on our laurels, but I think it is a really important start, and it is one for us to look to say there's hope and opportunity to really do something different than the status quo. And so I want to just talk a little bit about the two things I mentioned: community violence intervention and alternative community first responders, because both are, I would say, the way that we move forward to meeting our community's needs without relying on the status quo and law enforcement. And community violence intervention, I'm sure many of you have heard of programs like Advance Peace or Cure Violence, or many others that don't have a sort of well-branded title, but are folks in communities who know each other, who are doing the hard work through relationships and credibility and understanding folks and relationships to de-escalate and to respond to violence so that they avoid it before it happens, and to intervene when it does to prevent retaliation. And all of that sort of that language of violence as a contagion is really coming from a public health approach to how do we make our community safe from violence. Likewise, community first responders programs like the Cahoots program in Oregon is one of the best known. It's been around for over 30 years. And just last year alone, Cahoots, which sends trained first responders who are medics and counselors to emergency situations where 911 is called instead of a police officer, we saw that they responded to over 17,700 calls for service, which is a lot in a small town like Eugene, Oregon. And they didn't need any kind of police backup. That's always the fear. Well, what if there's something dangerous? That happened less than 1% of the time. So that really tells us just how much we are overusing the police, and that we have a different way forward that can make our community safer, invest in the right things, and actually meet people's needs where they are. So I share the concrete examples because what I do for a living is think about solutions and how do we move them forward, and how do we get the people who aren't bought in, who say, I really believe strongly in the police and I support the police and I back the blue, which, mind you, is not just conservatives in this country. There's been a lot of research and polling, and even folks who consider themselves liberal or progressive say, I support the police, at least in a role to address violence. So that's the reality of what we are facing in this country, and the challenge to actually moving toward a world in which we are investing in the community-driven sort of safety and wellness and ability to thrive. We are up against these forces where the average person in this country believes, well, the only thing I've ever seen on offer is the police, and I don't want none of that, because then I don't know what responds to violence or harm or crisis when it happens. We've got some real work to do to convince people that abolition and the presence of life-affirming institutions is in fact sexy, doable, and possible. And so I think we actually can have these conversations. Just the fact that in the past couple of years, community violence intervention is seen as a credible and legitimate response to gun violence when it happens. It's not just more police and prosecution. Gives us a concrete example of how do we communicate about what drives violence and what intervenes to make us safer in really concrete ways. And so I'll stop here because I wanted to just share both personally how I come to this work. I wanted to offer perspectives on, so what does it mean to put this work into practice and to bring in issues of power, of race, of equity, of how do we actually shift the dynamics of the status quo to what we want, and recognizing that that work is sometimes incremental and some of it is harm reduction. Because I know not all of us will necessarily go out into the field and work on abolition, but I think all of us will be working towards many of those ideals. And I wanted to offer a take on what it means to work on these issues in a way that comes to that ideal, but isn't necessarily right there in it philosophically.